Thank you. So I am moving to amend Section 7 in the following ways. First of all, Section B, as it stands, would be struck out, and instead we would add the following, and it would read, the prohibitions in subsection 1 with respect to e-cigarettes do not apply to retail outlets whose primary purpose is the sale and distribution of e-cigarettes and vapor products. So general prohibition on use in workplaces, absolutely. The case that these folks make is that a business establishment that sells e-cigarette products or vaping products is also a workplace. And therefore, they would be prohibited from allowing people, when they come in, to buy those products. And they're coming for the express purpose of buying those products. These business establishments would be restricted for people under, who are not of legal age to consume these products. They would be prohibited from entering the products. So this is not about access by youth, who are the people we're most concerned about accessing these products. So they're already prohibited from entering it. The issue of potential impacts of secondary smoke, but the potential impact of the vaping byproducts, which is subject of great debate, but understood, that does not become an issue because everyone who is in that particular business establishment is there for only one purpose, and that's because they're interested in sampling and potentially purchasing one of these products. So what these amendments, this amendment serves to do is have an exemption from the prohibition of use of these products in workplaces alone, in all workplaces, and have a specific exemption for workplaces that exist for the sole purpose of selling these products.
I understand the member's argument. I understand the arguments made by vendors of e-cigarette products. The reality is that these are workplaces, Honourable Chair, and we don't know the effects of the products that are being vaped.
In favour of this amendment, which would allow the use of vaporizers in stores that are selling them. The Minister, in one of his reasons not to support it, he talks about the fact that we don't know what is actually in these vaporizers, and they might be harmful. But the people who are going into the store, who are working in the store, the people who are working in the store are, I would very likely guess, and I think it would be an educated guess that anyone could say, are most like users of vaporizers. And the people coming into the store are people who want to purchase vaporizers. So you're talking about quite an enclosed circle of people who would be going into that atmosphere.
These are public spaces, they're workplaces, and therefore people going into them should not be exposed to a product, the harmful effects of which are entirely unknown.
Have done research. It might not have been approved yet by Health Canada or international health bodies, but they have done research and have found that it is a lot less problematic. There are far fewer chemicals, as they understand it, than there are in traditional cigarettes.
As proposed by my colleague from New Westminster, I think that that by making it impossible to demonstrate to folks what an e-cigarette does or how to use it is extremely short-sighted. I think that the idea that this government doesn't have the flexibility or the elasticity to permit, in very restricted circumstances, the demonstration of the use of an e-cigarette it's a bit of a cop-out.
That have contacted me on this subject, that people interested in making a living selling e-cigarettes should invest in the studies and trials necessary to get a Health Canada approval for such use, if they were serious about that intention.
I have told people that have contacted me on this subject that people interested in making a living selling e-cigarettes should invest in the studies and trials necessary
to get a Health Canada approval for
To get a Health Canada approval for Health Canada